Research now supports what teachers have always known, that learning is easier for a healthy child. However, air quality in our schools can impact student health and the ability of teachers to teach and students to learn. Poor indoor air quality, or IAQ, can cause headaches, drowsiness, and an inability to concentrate. In more serious cases, it can trigger asthma attacks and other long-lasting health consequences. Asthma is the most prevalent chronic disease among children. And as educators, we know that we can't teach to an empty desk, and the leading cause of school absenteeism due to chronic illness is asthma. In fact, an average 1 out of every 6 children, or 5 students out of a classroom of 30, suffer from asthma, and lower income and minority children are disproportionately affected. CTA's new Healthy Air, Healthy Kids project is a unique opportunity to make a difference in the quality of life for our students. The information in this short video can help administrators, teachers, and building staff learn how to work as a team to prevent and remediate simple indoor air problems in schools. Thanks for taking just a couple of minutes out of your very busy day to learn how we can improve our learning environments.
Feels like an animal is attacking you, like really hard. And it's like scratching you and stuff. That's what it feels like. And it doesn't feel good.
You can't breathe, so you turn all red. It's like having a heart attack when your heart stops and you have to get your inhaler quick before you die.
Students at school can be exposed to a variety of pollutants, including mold, dust, animal dander, fragrances, chemicals, and other allergens. Although they may vary widely in their sensitivity to pollutants, for those with asthma, school can not only be uncomfortable, but unhealthy. According to the Environmental Protection Agency, air inside a school building can be 2 to 5 times and sometimes up to 100 times more polluted than outside air.
When I walk into a room that has mold, or when I walk in and I'm sitting down and I smell perfume or something like that that doesn't agree with me, I get lightheaded, and then I take big deep breaths and then I breathe out. And usually people around me will notice, like, are you all right? And I'm like, no, I'm not all right.
For a student with asthma, learning and participating in school activities can be a challenge. For teachers with asthma, it can mean fatigue, poor morale, and missed work days.
There has been times when I would just try to talk myself into staying at school because I didn't want to miss the school day. It's a drag sometimes when asthma gets that far in the way of you being at school.
The good news is that asthma can be controlled through clinical management and the reduction of asthma triggers. The first step is to recognize the components of good air quality: comfortable temperature and humidity, an adequate supply of fresh outdoor air, and control of pollutants inside and outside the building. The next step is to understand that everyone has a role in promoting indoor air quality. Teachers can improve their classroom environment by reducing asthma triggers, discussing asthma with school nurses, and reporting uncomfortable and potentially unhealthy conditions to building staff. Teacher associations and districts can link with community asthma groups and work with the Environmental Protection Agency to develop a comprehensive indoor air quality management plan. The EPA's Iaq Tools for Schools program does just that. It puts an entire problem-solving network into place. It provides easy, no-cost, and low-cost interventions to fix existing problems and prevent new ones.
An indoor air quality management program is part of the many tools we provide in the Tools for Schools Action Kit. The Action Kit is designed to be tailored to the needs of that individual school district and, in fact, to that individual school.
The checklist is a quick way for teachers to take an inventory of classroom components that contribute to air quality, including room maintenance, animals and insect pests, moisture and mold, temperature and humidity, ventilation, and art, science, and education supplies.
We've been working with advising schools on indoor air quality for several years, and then realized that they really needed an easy way to both evaluate the indoor air quality and to have an ongoing sustainable program that would allow them to recognize indoor air problems before they develop. The program is really so simple that it doesn't take a whole lot of hands-on help. We can often do a walkthrough of a school with them to really show them firsthand what's going on in their school environment. In fact, we can help remotely just by conference calls and through presentations online and through email, etc. So we can be in contact with schools really all over.
In response to earlier reports of indoor environmental problems, the Fairfield-Sassoon Teachers Association and the district worked together to make significant changes.
The biggest incident happened in 2003 when one of the schools, Crescent Elementary, had to be totally demolished because it was so contaminated with black mold. And then in 2005, in a classroom when I had a leak in the ceiling, there was 1 week of water on the floor of my classroom, and in order to get any action by the district, I had to file a grievance.
Once these issues were addressed, CTA's Healthy Air, Healthy Kids project, the EPA and the local Asthma Coalition came on board to help support a comprehensive district plan.
It was totally based on communication, teaching teachers, just informing them, educating them on what they can do, even within their classroom, within their school, to make the classrooms healthier and safer for their students, and who to go to when there was a problem. One of the key components of this is just the relationships you build with other groups within the community. So the Solano Asthma Coalition has been very instrumental. The EPA, and being able to work with them and have them as a resource and have them come in and be able to do trainings and be willing to work with us, has been phenomenal.
We've been working for 6 years to try to actually get Tools for Schools into the districts, and it was just really difficult because the schools didn't really want to take on anything new. They've got their hands full. So now we're able to work with the presidents of the Teachers Association, and that's a much stronger entry for us because they know what's going on in the classroom, so they have a better understanding of it all. Our goal is just to support them whatever we can.
We're always trying to find ways to bring a partnership with the local community, with parents, with the schools, the business community, governmental agencies, whenever possible. And oftentimes that is very, very challenging. I think this program provides an opportunity to bring all those entities together to work for the welfare of children. We all talk about wanting to do that, but in reality, we don't seem to make that happen. So this was a great opportunity to bring all of those elements together.
The Tools for Schools gave us some material to integrate into our program. It's really proved to be an outstanding program. As a grown-up, I'm an asthmatic, and I can explain to my doctor or to my family what's wrong with me. Children can't do that. So rather than be part of the problem, I'd rather be part of the solution.
The biggest impact that this program has had, it has reduced my workload because now issues are being handled at school sites. So it's not coming up to the association level. We're not having to file grievances to get things completed.
Fairfield-Sassoon's experience is just one example of how communication and small affordable steps can make a big difference. Their efforts can be replicated or tailored to meet other association and district needs.
Our schools can be healthier environments for all of us to work, teach, and learn. Many California districts have taken the important step to pass policies that protect students with asthma. Working together, local associations, districts, parents, and state and local partners can promote indoor air quality in schools. Remember, a school that is healthier for children with asthma is healthier for everyone.